Hi there, here we are with our patient Dan. Dan just stopped by the office today for a 6-month follow-up visit. We did a Max Harvest Plus hair transplant procedure about 6 months ago. Dan had diffuse thinning throughout the top of his head. His hairline was not intact, and he was thinning throughout the crown. Dan flew in from Serbia all the way to have his hair transplant with us, and he's going to tell you the reason why he did that. Anyways, how is the procedure for you so far? How's everything going?
Oh, everything is nice, perfect. I don't have any pain, anything.
Excellent. So the procedure went well, no pain?
Yeah, nothing.
No swelling?
No swelling, nothing.
Awesome.
It's just perfect, yeah.
Now, I know you flew in from Serbia for the procedure.
Yes.
And obviously in Serbia, you're closer to Turkey.
Yeah.
And you were doing some research?
I do some research, and I want to do that surgery in Turkey and see what's happened there, you know. And I think about FUE, and when I see some of my friends, they do that, you know.
Right.
It's not good for me. I think only 30-40% of success.
Yeah. So the patients that you had that went to Turkey,
yeah,
their results were bad.
Bad, very bad.
Bad
because
results.
I speak with my hairstylist, you know.
Okay.
My friend got two
FUEs in Turkey.
FUE in Turkey, and I'm going after your surgery after 4 months. Go to hairstylist, and he told me, "Oh my God, your results is better than for him." And he got two.
And he had 2 surgeries.
Yeah,
You were only at 4 months.
After 3 years.
Wow.
He got
and you know you're not done growing yet, right?
Yeah,
you're only at 6
it's
months.
Only 6 months. I know.
Yeah. So he had some really early growth, which was terrific. This isn't common to get such early growth. He took great, which is unbelievable. Now, are you using Propecia or Rogan? Are you using any of those products now? You're not?
Not.
Okay.
Rogan at all?
Okay.
No one.
Okay. Excellent. And what would you say to someone who's thinking about having a hair transplant?
Just come to Dr. Blatt, to Dr. Blatt, and everything is be fine.
Awesome. All right, I'm going to show you off. Now, remember, we're only at 6 months. When we do these big cases, sometimes it takes up to 18 months to fully grow out. He had very thin hairline all the way across. We completely restored his face. So all this has been recreated. He had these larger recessions. I'm just going to turn you a little bit here, where on the profile, this kind of went up super high, and it made his face look bigger. So we brought the recessions down to reframe his face, make it look more squared off. Then I'm going to have you tilt your head back for me, please. And then we went through this back, and we filled all of this in. This was super diffuse and thin, and we were able to go through and fill all of this in. Same thing on this other side. We brought his hairline down all the way around. So you notice this has all been completely restored all the way through. If you look at the before pictures, you see how it's already completely reframed. As far as the suture line goes, we did a big case on him, took him all the way over here from the side. Okay, so let's take a look at that here, the suture line. Can't even freaking see it. Look at this. So this is it. If you can see that on the camera there, it's a little challenging to see, but the line's hit. It's like would be right here. That's the suture line. So I'm going to just kind of spin it around here. And then you can kind of see it through here. Right through there. All the way around. Through there. Very little. So you did great. You were a great patient. Really took care of it nicely.
Yeah.
I'm just going to spin you around a little bit more. It's literally perfect. It's excellent suture line. And all the way over here to the other side. Just perfect. Just perfect. Anyways, your results are phenomenal. The suture line's excellent.
Yes.
You did a great job taking care of everything.
Yes. Thank you very much for this procedure.
And I'm very happy
so
for you.
Happy.
Congratulations. Thank you very much for doing the video for us.
Thank you, Dr. Bolton.
You're welcome.